fundus image. First of all, what is the fundus? Fundus is the posterior part of the eye and including several important components. The components of the fundus: optic disc, macula and fovea, blood vessels and retina and final choroid. And fundus image. Introduction of the fundus image. Introduction of the fundus image. Fundus imaging allows eye care professional to detect and monitor retinal diseases. A clear, well-captured image ensures accurate diagnosis and treatment planning. Poor image quality can lead to misinterpretation, affecting the patient's management. And so the patients are understanding the importance of fundus imaging in preserving vision. This fundus image is a normal fundus image. Fundus photography involves capturing images of different regions of the retina to get a complete picture of the eye's health. These regions include the posterior fold like macula or disc covering the path, and supratemporal quadrant, and second is infratemporal quadrant, and third is supranasal quadrant and infranasal quadrant. This is for non-mydriatic fundus camera. Is commonly used for this process, providing high quality images without recurring dilatation in most cases. And then clear instructions to the patient. To obtain a clear fundus image, it is essential to provide clear instructions to the patient. Patients should be informed about the purpose of the test and the importance of keeping their eyes open while they should be guided to where to focus and encouraged to minimize blinking during image capture. It is also important to avoid movement and to inform them about any discomfort they may experience during the procedure. Proper patient's positioning. This is very important. Ensuring the correct positioning of the patient is key to obtaining a good image. Patients should be seated comfortably with a straight position. Their eyes must be aligned properly with the instrument, and the chin rest and foreguard strap should be adjusted for stability. The patient should be guided to focus on the fixation target to ensure a sharp and well-centered image. And the importance of dilatation. Dilatation plays a significant role in improving the visibility of retinal structures. Common dilating agents include trafficamide 1% and phenylephrine 2.5%. It takes approximately 15 to 30 minutes for full dilatation, and during this period, this patient may experience temporarily blurry of vision and light sensitivity. While non-mydriatic imaging is possible, dilatation enhances image quality and significantly. Patients with conditions such as redness, allergies, injuries, or a shallow anterior chamber and ACIOL should not be dilated. And ensuring the fundus image. And ensuring the appropriate room ambience. In the environment in which fundus imaging is performed affect the quality of the image. A dimly light room helps reduce pupil constriction and allows for better image capture. It is important to avoid bright light sources near the patient's eye and to maintain quiet and comfortable setting. Adjusting the background setting on the imaging devices also helps in optimizing contrast for the clear images. Good quality fundus photograph. A quality fundus image is characterized by the normal pupil size 2 to 4 mm, a clear optic media, and good patient cooperation. And poor quality fundus photograph. On other hand, poor quality images may result from conditions such as myotic people, pseudo explanation for glaucoma, uveitis, and neurological disorders, cataract, vitreous hemorrhage, and vitreitis, posterior capsular opacification like PCO. Is an image is of poor quality. It is advisable to attempt another capture after dilatation. Identifying and avoiding artifact. What is artifact? Any distortion or unwanted features affecting the image. That is artifact. And reason for artifact. And blurred images, it is common for poor focus on patient's movement. Second one is shadowing, lens obstruction and misalignment. And third is reflections and glare is common for excessive light and unclean object. Non-gradable fundus photo. In some cases, it's not possible to obtain a fundus image due to opaque media. Conditions such as corneal opacity. First one is corneal opacity, and second is hyphema in AC, and hypopyon in AC, and then myotic people, and mature cataract, and posterior capsular opacification like PCO, then pupillary membrane, and occlusion people, and vitreous hemorrhage. Very important of the session, the artifact in the fundus photographs. And the image have some artifact, but the reason is not corrected focused fundus. The solution is refocused well. The second image is have artifact, that is the reason of eyeglasses crossing. Then solution is asked to patients correct your eyeglasses or hair. Continuation of the artifact. The images have an artifact. Main reason is dust in objective to camera lens. Solution is clean the camera lens. This images have artifact, non-corrected quadrant. Then solution is refocused correct quadrant. This image have artifact for blurring image. Solution is sharpen image. And then this artifact image over brightness or over flash of the light, and solution it reduced brightness or flash of the light. Continuation of the artifact. This artifact of light comes from other sources and out of focus. Then solution is make room dark or light off and focus correct. And then this pixels artifact, maybe patient is closed late, and solution is recapture the image. This image is artifact for myotic people. Then solution is needed for dilatation and take fundus photo. And this image for artifact, hazy view, may be immature cataract. Then solution is need retinal examination. This artifact of very hazy view, this is main reason of mature cataract, and solution need for retinal examination, and another option for B scan. This artifact image is wrong quadrant of image, and solution is recapture the fundus image. And solution. To improve image quality, it is important to ensure that the camera lens and instrument optics are clean. Proper focus and alignment must be checked before capturing the image if needed. Reposition the patient and readjusting the fixation point can help achieve the clearer images. On instrument and maintenance, do and don'ts. Maintaining imaging equipment is crucial for capturing high quality images. to external part of the camera should be cleaned daily using a soft cotton cloth. The optic should be cleaned with dye cotton in a circular motion, following the same direction each time. The instrument must be properly covered and shut down after use. It is important to avoid using any liquid cleaning solution on the camera lens and keep to the surrounding area dust-free. Assessing of image quality. Key features of good fundus image, and second is clear optic disc and macula visibility, and well-defined blood vessels, even illumination and contrast, adjust the brightness and contrast and focus if needed. This image should be taken for different fields, including disc centered, macula well centered, and temporal to macula, along with the supratemporal, infratemporal, and supranasal and infranasal quadrant. Best practice. Taking a high quality fundus image record attends to several key factors. Proper patient positioning and clear instruction help to obtaining the stable images. Dilation, when appropriate, allow for the wider retinal field view. And primary eye care centers seeking a daily consultations opinion viewer dilatation is recommended. A well-maintained imaging environment and regular equipment maintenance plays a circular role of reducing artifact and improving image quality. Before interpretation, it is essential to check the image for clarity and ensure all record have been captured correctly. And finally, good fundus imaging always helps with diagnosis and speed up the treatment, help in monitoring the disease progression and mark intervention at the right time. Thank you.